The chart that I'm about to share, or we're about to share together with you, per se, is basically the results of individuals that have COPD. And all they are doing is consuming at 9 a.m. in the morning 1 glass of nitrate-rich beetroot juice, as is designated by the acronyms down below. The P in the L, I know it doesn't look like an L, but it's supposed to be placebo, beetroot juice, and then the NR, nitrate-rich beetroot juice. So what we have here is a 30-meter increase in walking distance among individuals which have COPD. And all they did in the morning, 9 a.m. in particular, was consume 1 glass of nitrate-rich beetroot juice, and that was it over a 12-week period of time. No dietary changes outside that 1 glass of beetroot juice, or basically any sort of exercise regime or rehabilitation at that point in time. That is just astounding. A 30-meter increase in walking distance. Now, if you look at the placebo group, it's almost like it went a little bit backwards. But if you look at the nitrate-rich beetroot juice group, pretty amazing overall. So with that in mind, also too, I left up this chart of acronyms as well. So for example, if you see PR, you understand it means pulmonary rehabilitation. You'll see some of these acronyms as we proceed forward into the study itself. So you always come back to it as needed just to familiarize yourself once again. But with that in mind, let's get right into the study. Again, pretty amazing because all that was really done was the consumption of 1 glass of beetroot juice in the morning, in specifics containing 400 milligrams of nitrates, and that was it over a 12-week period of time. So let us proceed. Beetroot juice supplement lowers blood pressure and improves exercise capacity in people with chronic obstructive pulmonary disorder. A 12-week course of daily beetroot juice supplement for people with chronic obstructive pulmonary disease lowered blood pressure and improved how far patients could walk in 6 minutes, the research published, obviously, a little while ago. Participants were randomly allocated to receive either. Now, you notice you see the 12-month there? That's a typo. And just because, what I like to say often is trust but validate, look at the abstract, 12 weeks. I meant to say 12 weeks. 12-week course of nitrate-rich beetroot supplement, 70 milliliters of a concentrated beetroot juice containing 400 milligrams of nitrate once per day, or the placebo. Now, that 400 milligrams is not necessarily attainable in diet. You're looking at about an average, per se, of 250 milligrams of nitrates per 100 grams of beetroot, per se, or beets. So that gives you a little bit of a variance. Fermented may have higher. So you're going to have some adjustments to make depending on the type of beets you use. But on average, 250 milligrams per 100 grams. So to proceed, researchers found that those taking the nitrate-rich supplement experienced an average reduction in systolic blood pressure by 4.5 points compared to those taking the placebo. There was also an average increase around, to reiterate once again, 30 meters in how far patients could walk in 6 minutes for those taking the nitrate-rich beetroot juice. Again, I'm going to look at the state here. This is part of the discussion from the full study. It says it quite well. And then we'll look at the conclusion a little bit later on in regard to the public release. To proceed, the possible role of dietary nitrate supplementation versus control. Also, too, I'm going to caveat this. We're not here to prescribe or diagnose. So you're going to read some things in the study, and you go, again, consult your healthcare practitioner. To proceed, the possible role of dietary nitrate supplementation versus conventional antihypertensive medication or synergies with is not studied here directly, but a non-pharmacological approach based on foodstuff may be more acceptable to some patients than taking in medicine. Second, some people might not be able to tolerate antihypertensive drugs or might encounter negative effects. Beetroot juice that is high in nitrates is well tolerated and has a good safety record. Thirdly, the combination of NR-BRJ, nitrate-rich beetroot juice, with an antihypertensive medication may have a synergistic effect on blood pressure. Again, work with your medical practitioner. Another important finding in the current study is that nitrate-rich beetroot juice may produce meaningful improvements in exercise capacity in individuals with COPD in the absence of PR, pulmonary rehabilitation. We, quoting, observed a 30-meter improvement in 6-minute walking distance compared to placebo. This treatment effect exceeds the reported minimum clinically important difference for 6-minute walking distance in individuals with COPD, and that is pretty amazing. And is similar to the effect of nitrate-rich beetroot juice seen in the context of pulmonary rehabilitation. I'll let that sink in for a bit. And is consistent with the acute effect seen in people with COPD who require supplemental oxygen. Is that amazing or what? All right, now I'm going to pull out a few tidbits of information from the full study. There will be the DOI citation, so you could delve into that on your own. For those that are not familiar with DOI citation, it basically is a link to the full study. To proceed, participants were asked to drink their intervention juice, 1 beverage daily at 9 a.m. for 90 days. Again, timing is often very important with consumption elements because of the rhythms of an individual's biology. To proceed, participants were asked not to alter the usual diet and to keep antihypertensive medications constant in treated patients with hypertension. Study procedures are outlined in the figure. Again, before anybody delves on their own, work with. Lastly, found no evidence of an interaction between mouthwash due to use and treatment effect. The reason I wanted to elucidate on that highlight was generally because there's some concern that mouthwash can deactivate the health benefits of nitrates. And in this case, in this particular study, that was not observed. All right, now the conclusion from the public release. Patients taking part in this trial generally found that beetroot juice supplement acceptable, and they saw benefits in terms of their blood pressure and mobility. This suggests they may see improvements in everyday life and should have a lower risk of heart disease and stroke. But again, that will be studied in patients for long term to confirm this case. Again, even though it'll increase mobility and a reduction in blood pressure, often they don't want to make an assumption that that's going to yield better cardiovascular events. And so they want to conduct further studies in the future just to validate the play it safe. Beetroot juice has been consumed widely and tested in other research, so it has potential to be a safe treatment for people with COPD. Now, this is just amazing. Can you imagine something that has such a profound effect, so readily available and generally seen as safe, as doing nothing more than consuming 1 glass of beetroot juice containing 400 milligrams of nitrates in the morning and yielding this result over a 12-week period of time? Who knows how much benefit may be seen over a longer duration? But still, just the same, it is amazing. It's easy to incorporate, work with a medical professional, and it is just eloquent in its simplicity and amazing in its impact, especially for individuals with COPD itself. Again, gratitude to the researchers. You have to give them gratitude for the main reason being is you want to keep on encouraging research like this that basically yields the power of individuals' health into their own domain. And again, as always, I am humbled you watch and look forward to seeing what you and I share next week. Catch y'all next time. See you then. Bye.